Am I going to be there for 5 minutes or an hour? Am I going to be able to swallow or spit after 1 minute or 10? I need to know ahead of time approximately how much time, because I'm monitoring my own energy levels, and I'm allocating a certain amount of energy and tolerance and sensory abilities to navigate all this.
Hello and welcome to the Business of Happiness podcast. I am your host, Dr. Tarryn MacCarthy, and today we have with us a very special guest. She's a good friend of mine. She is an amazing human being. She has been a former guest on the Business of Happiness podcast, and today she joins us with a very specific intention of sharing her expertise. She is a marriage and family therapist who works and enjoys working with couples, neurodivergent individuals, specifically related to emotional regulation and relationships and intimacy. And as a trauma-informed coach, she has amazing resources. She is the host of a brilliant podcast called Neuroqueering and has an incredible group coaching program called Neurocommunity, which we're going to be talking about today. Please join me in welcoming the one and only Pasha Marlowe.
Hello.
Welcome back to the show, Pasha.
Thank you so much, Tarryn. I love being here. I love being here with you. And thank you to everyone for welcoming me. Thanks.
It's so awesome to have you, because one of the things that I wanted us to talk about today is your perspective, having coached so many clients and couples who are or identify as being neurodivergent, and knowing what their challenges are as patients to all of us beautiful medical and dental professionals, and what their challenges are in the medical and dental chair when they come to us. What I'm so excited for you to share with us today is how we can better serve our neurodivergent community.
Thank you. I'm so glad you asked. And as I was working on research for this podcast, I realized, and it almost brought me to tears, how necessary this is.
Right?
Yeah. I'm really honored to be here talking about this, because it's much needed. And at almost every appointment I have in talking with an individual or a couple or a group, this comes up in some way, whether it's medical trauma or dental phobia or discrimination in healthcare, and the specific needs of neurodivergent minds in medical care. So I'm really excited to talk about it.
Yeah, I think this podcast idea came when Pasha and I were we were just chatting one day about some of the things that she's been noticing in her clients, and how actually you came with a question to me: how do we address these things? And it was really interesting to have this conversation, because I think we learn some of these during our training. As I was telling you, we do learn how to support our neurodivergent community. But I think unless we pay attention to what's happening in current day situations, and with things happening in society, and with new medications that are coming out, and with new diagnoses and new identities that we're understanding, it's very important for us to stay abreast of that always, and to be keeping ourselves fully aware of what our patients are experiencing so that we can serve them better. So as a coach, what do you find is the biggest challenge for your clients in terms of taking better care of themselves? In other words, we know we got to go see the doctor. We know we got to go see the dentist. But what is the challenge of simply getting them there?
Yeah, I broke it down into 3 parts to make it easy and clear. The first one is executive functioning skills. The second one is sensory processing issues. And the third one is what we call in the field RSD, but it's rejection sensitivity, and it's about shame. And those 3 aspects create a rather complicated issue for neurodivergent minds and navigating healthcare.
So walk us through each one of those.
Yeah. So executive functioning, I'm sure your listeners have heard about it, especially as related to ADHD. And by the way, neurodivergence and neurodivergent minds include ADHD, autism, trauma, generalized anxiety, anything where it's 15 to 20% of the population. We're talking about a lot of people here. It's a wide spectrum of divergent minds. So
don't you suspect, by the way, sorry to interrupt you, then it's probably more than that.
Oh, yeah.
I
Yeah.
mean, when you said 15 to 20%, I was shocked that it was that low. I feel like it's such a much larger percentage of our population that fall into those categories.
I believe so, especially if we include trauma and the effects of trauma on the mind and the body. Absolutely.
Yeah.
I can't imagine it isn't more. So it's certainly undiagnosed and misdiagnosed and underdiagnosed, especially, and I won't go off on this too much, but especially for girls and women. And so, and people of color. So it's really under researched and underdiagnosed. So I agree. It is more, but let's say it's minimum 15 to 20%. That's a large amount
It's
of
1 in
people.
5 patients walking in the door at the very
Exactly.
least.
Exactly. Right. And so back to those three aspects, the first one being executive functioning. And this is the irony of so much of, in particular, I'll say ADHD, is that, if you have ADHD or any executive functioning issues or challenges, you need the medication to remember to take the medication. You need, I mean, I know it's funny too. I mean, I have ADHD and I know I need the meds, but I need the meds to remember to take the meds. And once I take the meds, I might have enough focus to remember to call my doctor to get the refill for the meds. I mean, but much less to call the doctor to think ahead for like dental care 6 months ahead, 2 times a year. Like it's out of sight, out of mind. Object permanence is an issue. Organization and time management, just the skills it would take to follow up with an appointment and then to remember the directions for, let's say, hygiene, dental hygiene, and then to remember to actually do it. So many of my clients don't even remember to brush their teeth unless they're looking at their toothbrush. Some of my clients don't remember to brush their teeth so much that we need to create a habit with that habit, like brush your teeth while you're in the shower, with like brush your teeth while you're waiting for your coffee to brew, whatever it is, because of the object permanence. And so there's the thought that, if you have a lot of dental anxiety or phobia or problems with your teeth, that you're going to be more motivated to then have proper hygiene, but it's not true. It actually, and this goes to the RSD and shame, exacerbates the problem. And then there's shame around having the issue. So now not only is it hard for us to remember to take care of ourselves, now we have shame about not remembering to take care of ourselves. And now we have shame in making the appointments or going to the appointments because we know we're going to be met with further rejection, criticism, and judgment. So I kind of just combined two, executive functioning and rejection sensitivity. But both of those are really important to know with the neurodivergent community. This is, again, ADHD, autism, trauma, anxiety. It's kind of an umbrella term for these. But does that make sense? How it's
totally
spiraled? Yeah.
And I love that you mentioned shame because, sometimes we think that reminding someone of the problems of why they're not doing what they're doing is helping them understand. But sometimes that can come across as shaming as well.
Yeah.
And so sometimes even as a practitioner, we think we're helping, but actually we're compiling that shame component and making the situation worse.
Yes. The last time I was at the dentist, and I am a neurodivergent mind with ADHD, autism, anxiety, and trauma, and probably other things too, but just those enough. I'm in the dental chair, and I said, I've had a really hard 3 years. I've been caretaking my ill son. I haven't kept up with my hygiene as much as I like. I haven't been to the dentist in 3 years. So I'm going to have a lot of soreness, extra soreness and flossing. And I thought I was advocating for myself and stating that I was already extra nervous and probably was going to be sensitive to any extra shaming. And not minutes later, the dental hygienist said something like, "You really need to floss your teeth better," or something very, and I cried. I thinking, well, okay, I'm advocating for myself and I'm in this field knowing that I needed to communicate this. And how can I communicate this better? So I said, I know I need to do better. But what I really could use is some encouragement and some extra gentleness from you right now. And if you don't know how to say anything along those lines, like, I would rather you not say anything at all, because I'm so close to tears right now. I'm not going to be able to continue this appointment. That was my last dental appointment. And And I thought I advocated for myself well, and I take care of my teeth better than most. So just imagine somebody who had, really neglected their dental care. So there's that vicious cycle of avoiding the medical appointments and then shame around avoiding them and avoiding dental care. And anyhow, so you can
I
imagine.
think that that's such a beautiful, thank you for sharing that story. I appreciate it, because I think we don't hear that side of things often enough of, okay, I understand that I shouldn't be shaming, but what should I say then? And so I love what you just offered was what you needed in that moment was compassion,
Yeah.
support. And mostly what I heard there was just listening and acknowledging, like, oh, okay, I hear you. And yes, I'll try to be extra gentle. Like that just alone would have made you feel a little safer.
Absolutely. Mirroring back,
Mm.
I hear you've had a hard few years. Mirroring back, I hear you need some extra gentleness. Mirroring back, silence is better
Mhm.
than something shaming. I hear you saying you're close to tears, and I think it's brave for you to be here. Anything
Yeah. Yeah.
related to that. So yeah, that active listening is really important. Is really important. I mean, emotional dysregulation comes up for all neurodivergent minds, and so there's this feeling of almost like our nerves are on the outside of our skin, and we have
Mm.
this we've grown up with and had something like 12 times more. It's so funny. I can't retrieve the numbers very well. It's either 12 times or 20,000 more times. And maybe the math is the same of more criticism, judgment, and rejection than a neurotypical mind by the time we're 12. So maybe that's the 12 I'm remembering. But either way, we'll just say many, many more. So we've
Yeah.
already grown up with a lot of criticism and judgment. So that's our lens. So we know it's coming. And so we're already heightened to it. And then
Mm.
we do this masking and people pleasing and kind of armoring up, which leads into, trauma, and that trauma response, which sometimes can look like dissociative behavior
Mm.
to protect ourselves from onslaught of shaming or criticism, but also onslaught of sensory issues, which was the third one. So it was
Mm.
executive functioning, rejection sensitivity, and that shame spiral, and then sensory issues.
Mm.
So yeah, do you want me to talk about sensory
Yeah,
issues?
I mean, I think that's such an important thing to talk about,
Oh yeah.
because I'm trying to picture a dental office right now, or medical office. We make the lights really bright so that we can see what we're doing. At least in a dental office, there's a very specific dental office smell that's only found in dental offices. And we, working in a dental office, we become nose blind to it, but it's always, always there for our patients. And
Yeah.
then, not to mention the sounds that are happening in a dental office. I think, once I went to a chiropractor and she was trying to figure out, she was trying to test my stress response, and she was going to give me some sounds of like the worst, most stressful sounds ever. And there was like these aggressive dogs barking, and then there was a dental handpiece,
Oh,
which is
wow.
like shown in research to be inciting of stress. Like that
Yes.
immediately triggers a stress response. So here our neurodivergent patients are walking into the office with all these very aggressive, over the top sensory stimuli.
Yes.
So tell me how that's impacting the people you're working with, and yourself as well in your experience, and what we can do to support you in that.
Yeah. Well, a lot of times, as you're mentioning, just a sound can trigger trauma. So I always come back to this trauma-informed place. The sensory issues being sight, sound, smell, taste, touch, but also proprioception and vestibular and interoception. But all of these things, it's like an onslaught. It would be
Yeah.
like it would be like a neurotypical person walking into Times Square on New Year's Eve and hearing 3 different bands playing and watching fireworks and seeing, neon lights and signs. Like, this is my brain all the time. And so
Mm.
walking into a medical office is like that, because I'm taking in empathetically a lot of the emotions in the place, other patients' emotions and fears. I'm taking in the lights, the sounds, the smells, um, the textures, like of the. I'm just gonna have a little trauma trigger right here, but like thinking about the plastic or the chain around the neck and the of the, what do you call it, a gown? I call it a
Yeah.
gown.
Or
Yeah.
even that, or just the patient napkin. Like we don't, just
Napkin.
anything we're
Yes.
wrapping around your. I didn't even think about that, Pasha. You're right. We're constricting, confining,
Mhm.
chaining.
Yeah. And I mean, trigger warning to any listeners, but trauma comes up. And I think this is really important. There is a high correlation between trauma and the neurodivergent community, and in particular for girls and women's sexual trauma. And I will just say that there is a very common trauma response with anything around the neck, oral
Mhm.
stimulation. So being put in a situation where we need to be asked to do something orally that we don't want to do, and lying down in a chair or on a bed and feeling like we can't get up, like that's already enough trauma. So now you're adding smells, bright lights, the sounds, or tastes and textures, and it's an onslaught.
Hey guys, I'm interrupting your podcast episode to let you know about an incredible new program that I'm launching in January of 2023. It is specifically for practitioners in medicine and dentistry to help you rediscover happiness and inner fulfillment within your profession and your life. I remember what it was like for me when years ago I was so depressed and anxious and feeling like I had created and built a treadmill I just couldn't get off of, pushing through every day and wishing my life away. This program is the how of how to find happiness in your practice and in your life. Because we know that when we feel good, that's when we can do good. Check out thebizofhappiness.com/radical happiness or click the link in the show notes. I cannot wait to see you there.
So yeah, there's different ways to manage it. For me and for a lot of neurodivergent folks, we come in with very purposefully like comfortable clothes, usually loose clothes, soft sweaters, soft socks, often I can't think of what it's called, but when the sleeves have like a thumb hole, so you have a little bit more like this protection, so you can maybe get a little bit more comfort in the palm of your hand, holding something like a fidget spinner or a soft rabbit's foot or something, or a stone or a healing crystal, something to hold would be very helpful for the patients. Even something like allowing somebody to bring in a stuffed animal or a weighted blanket or a soft blanket would be really helpful. And then being aware as the medical professional to limit whether it's perfumes or just other smells, because it's already going to be an enormous amount of that. But knowing that there's certain things that, like the sound of the drill, I'll call it, just because I don't know the medical term for the dental term, but that the higher pitch sounds are going to be more startling. And so allowing the patient to know, like, this is coming, this is going to be a loud sound, or this is coming, this is going to be cold, I need to do this for a certain amount of time. Sometimes I'm sitting there in the dental chair and I don't know how long I'm going to need to be in this situation. Am I going to be there for 5 minutes or an hour? Am I going to be able to swallow or spit after 1 minute or 10? I need to know ahead of time approximately how much time, because I'm monitoring my own energy levels, and I'm allocating a certain amount of energy and tolerance and sensory abilities to navigate all this. And so if I could time it out and know I need to do this for an hour, I know how much energy to put into each section of that. Does that make sense?
Absolutely. And so what I'm hearing is creating a sense, I hate the word control, but a sense of knowing what to expect, a sense of
Definitely.
safety. And also, I'm guessing this is very patient dependent. So having that conversation, what do you need?
Yes, exactly. Opening up space. I call this access intimacy, or just access needs, opening up conversation, safe conversation for the patient to explain what they need. Um, do you need me to explain directions verbally? Do you want to see them in writing as well? Is there another way I can explain this? Do you want to take breaks? Do you need more sensory breaks? Do you need to get up out of the chair after a certain amount of time? Do you want me to give you a timer? There's so many ways. And then before I forget, the ceiling is really important. I know you probably already know this, but we're lying down. We're already, whoopsie, in our trauma triggers. And the ceiling alone can be a very common trigger,
Hmm.
the image of the ceiling.
Because
Because
you're on your back
you're on your
looking
back.
up. Mhm.
Ceilings are already triggering for probably obvious reasons related to sexual trauma. But if there is something to look at, it could be a sticker on the ceiling. It could be a mobile. So very
Mm,
helpful.
mm,
Sometimes to replace some of the fluorescent panels with, those ones that have like clouds in them.
mm, mm.
So helpful. I feel like it's a lifeline. Like and
Hmm.
this is true in any medical appointment, certainly in the dentist chair, or even an acupuncture or in a massage, when that sounds so pleasant. But if I'm triggered in my trauma when I'm lying down with another person performing anything, the ceiling is number one
Wow.
important to me.
Wow. That's
Mm.
great. That's a great tip. Another thing that I know I started incorporating a couple of years ago, and you'd think this would be common practice, but unfortunately it isn't. And it's such a great reminder to all of us is to ask for permission and consent. So one of the things that we tend to do is get consent at the beginning of I meet you, you sign this consent form. I hope you understood everything I just went over, all the millions of medical terminology that I just used and exhausted you with. And then I use that consent to kind of go through whatever I need to do going forward.
Yes.
And it really only takes a second to say, is it all right with you if I touch your face? Is it all right with you if we get started today? Is it all right with you if I put my hands on your mouth? You
Yes.
know, and I think we forget that very first touch is
Yes.
so important.
Yes. Yeah. Right. Rather than
Open up.
open
Mm,
wider,
mm, mm, mm.
yeah, saying, can I get a closer look? Can you open your mouth a little wider so I can see better? Or just anything that feels more consensual or collaborative would be really useful. Definitely. And there's different people coming into the room. It's the first person you see, and then all of a sudden there's this other strange person coming in, and then all of a sudden, often the dentist or the surgeon comes in right at the end, and they're the one who's actually going to be, doing surgery or opening you up or doing something really, and you haven't had any rapport or trust with them because they come sweeping in with less time. And then all of a sudden you're like, wait, who are you again? And I'm supposed to automatically trust you because of what, that degree? I don't know. And there needs to be a little bit more, hi, how are you?
Yeah. And I think that that's also so important to remember with our younger patients. I think so many times we forget that 20% is also living in our younger patients. And I bet you that number is much higher since COVID in terms of
Oh, yes.
all the impact that COVID lockdown had on our youth. But, having that same sense of respect and understanding
Yeah.
for the younger patients is so critical.
Absolutely. And a lot of neurodivergent people, including kids, they're not able to communicate as
Right.
clearly to a neurotypical person. Maybe to another neurodivergent person, they would make sense. But let's say there's an opportunity to write down on a piece of paper what their access needs are if they're
Mm.
having trouble communicating. Is there any other way that they feel comfortable? Maybe through a text, or is there something they can? I don't know. Is there a way they could show you on the screen?
Oh, I
Uh,
love that, Pasha. I love that idea because definitely I've had that experience with patients who just don't speak.
yeah.
Younger kids who just what needs to happen. You think you're being very trying to create that rapport, establish that relationship, but they just don't want to talk to you. I love the idea of using text format.
Yeah, because it's a little bit more distanced.
Mm,
I'm scared of the noise. I need to go to the bathroom, or can you tell me how long I'm going to sit here? Whatever.
mhm.
It's hard to speak up, and if you've had a lot of trauma and you tend towards avoiding conflict and people
Yeah.
pleasing to keep yourself safe, and that's a part of you that's kept yourself safe all these years, it's that much harder to advocate
Yeah.
for yourself.
Can we talk about we're talking about those responses, trauma responses that look like, hiding, not
Yeah.
advocating, not speaking up, just
Mhm.
being fearful, avoiding.
Yeah.
What about the response of protection, aggression, anger?
Mhm.
Can you talk about that a little bit?
Yeah, a lot of times, somebody who's neurodivergent, let's say, an autistic mind, you might see a meltdown or aggression or conflict, and that person is typically in extreme stress response. So
Yeah.
one person could say this is a challenging behavior. This person is acting out. This person isn't being socially acceptable. From the neurodivergence point of view, they're overstimulated. They're stressed. They're in panic mode. I am a friendly talkative person, not not with my dent. My dentist probably thinks I'm very coy and cold and rude because I shut down. I shut down and I give one word answers, and I probably have a frown on my face the whole time, and I'm rushed and I'm looking at my watch, and I'm sure I'm not likable to them, right?
Mm,
And so that's my fear, panic, and anxiety response. And
mm,
so yeah, knowing that likely the person in the chair who's neurodivergent is masking, which means covering up their natural tendencies. Their tendency might be to stim. Like I rub my feet together. It's called cricketing, where you like rub your feet together and kind of to stim and to release anxiety. And
mm,
so when I'm in the chair, I'll try to take my shoes off and do that. Likewise with my hands, like you'll see me like clenching my hands or fidgeting with my hands. So it's good, and that's to me releasing the anxiety. So somebody who's aggressive or angry or starting to act out, offering something like a fidget spinner or a fidget toy or something to hold might really help them pull that anxiety and stress into an object, or like squeezy ball, those stress
mm,
balls, for
mm,
example,
mm.
because it's never really about aggression. Typically, I'll just say it's never about typically it's not about aggression or anger as much as it is stress and anxiety
Yeah, yeah, and protection.
and
Yeah.
protection. Yes.
Yeah, yeah. Oh, so good. So good. I feel like we could talk about this for years.
No, but it's really important, right?
It's
I want to
really
empower.
important.
Yeah, I want to empower neurodivergent minds to advocate for themselves and speak up and communicate and find ways to communicate. But right, just as importantly, I want to make medical professionals aware of what they can do to help ease, and it's going to ease their struggles as well, and reduce the medical professional trauma triggers too towards the patient.
100%.
Right?
Yep. I mean, I think that this is one of the big reasons why I wanted to bring this conversation is because I hear from the medical and dental community, one of the things that's preventing them from feeling happiness in their work is when patients sit down and say, I hate being here. I mean, that's a big thing we hear as dentists is over and over again, 20 patients in your chair going, I hate this. I don't want to be here. And just having that knowledge that that might be coming from a fight or flight response. It's got nothing to do with
Absolutely
you. It's just
nothing.
they are in an active trauma response. Immediately, that can give some awareness and compassion and understanding so that we can have a little bit of a conversation or just see things a little bit differently, that it's not necessarily an indication of what you are or aren't doing, but maybe being aware of how you could choose to do things slightly differently to make the environment more safe, feel more comfortable for your patient. And they might actually just be in an active trauma response.
Absolutely.
Mm, mm,
Absolutely. Yeah.
mm. Yeah.
Yeah. I love your awareness of it and your willingness to learn more and to educate about this.
Oh,
I feel comforted already knowing that this conversation is going to be out there for
yeah.
my mental health
I think
friends.
we should. I think we need to have it more, to be honest with you. It would be great to also empower and support. I mean, you mentioned chiropractors. You mentioned, so
Mhm.
we're looking for so much help outside of um, Western medicine, even where
Yeah.
we can even get some more support. I think sometimes we go to those places because we think they might be different, but they might also not have the same tools to be able to support neurodivergent communities.
Yes, quite true. Right. Because when I was thinking about this, and I was thinking about things like acupuncture and
Mm.
massage, people assume, oh, that's self care, that's a spa day. I wish it were, but there's a lot of the same challenges there. And so, yeah, I might need noise canceling headphones and a weighted blanket for my massage
Yeah.
to keep myself safe and feel comfortable. So, yeah, the conversation needs to be out there, and it decreases shame around it from both sides if we continue to talk about it. So, I hadn't faced my own shame around it until I started thinking about this particular episode, and it feels really good to say it out loud how challenging it is for
And
me as well
I
as
th-
others.
I think it's also so important if you're listening to this episode and thinking, why haven't I taken care of my, we beat ourselves up.
Right.
I know I got to go to the dentist. I know I'm supposed to floss my teeth. Let this just be one of those moments of self-recognition where we let you know you're not alone. And maybe this is an indication of a trauma response for you, or something that has been fearful or fear inducing for you. And so having a little bit of self-compassion can help us go a long way in being able to take care of ourselves better instead of beating ourselves up over it.
Absolutely. And just the idea of thinking from a medical professional or even a therapist point of view, if our clients truly cared about their mental or physical health, they're going to make an appointment, or they're going to follow through, and they're going to follow up. They're going to find money to pay. This is not true. I mean, that's ableist and classist. And there's so many aspects to why it is a challenge across the spectrum for neurodivergent people, disabled people. It's just, it really is a bigger conversation.
Awesome. Oh, thank you. Thank you for all that you do. Thank you for supporting and for being there, and such a phenomenal resource for so many people in our community. I know it's more than 20%, Pasha. I know.
I think so too.
I absolutely know that in my bones. So for those people who are listening to this episode and
Yes.
are hoping to learn more about you and more insight, tell us how to find you.
Easy. My website is pashamarlowe.com. You could find me at Instagram and TikTok as your Neuroqueer coach. And I have a neuroqueering podcast, and Neurocommunity is my group coaching program. But all of this, in case none of that made sense and you can't remember it, like I wouldn't be able to, pashamarlowe.com is like the hub for all of that.
Wonderful. Thank you so much for being here today. I appreciate you more than you know.
Thank you so much, Tarryn. Always a pleasure.
And thank you to so many of you who have joined us here today on this episode. Thank you. Thank you for being open to new perspective. Thank you for caring so much about your patients and about your mission and purpose in this world. And thank you for loving and supporting everyone, and for being open to just having new information, new awareness. And remember, when you take care of yourself, that's when you can also take care of the people around you. Because when you feel good, that's when you can do good. Bye-bye.